Hi, I'm Dr. Peter Vila, and thanks for checking out my channel. In this episode, I'm going to talk about common questions that people ask about their nose. Now, in general, most people's noses you don't actually notice. If you think about the most beautiful celebrity you know, chances are you don't really know what their nose looks like unless you're looking at a picture of them. The reason is because the nose tends to blend in. When you look at someone, you notice their eyes, you notice their mouth, and then maybe you look at their nose, and if it's really out of whack, if it looks larger than it should, then you notice it. But a really beautiful, ideal nose really should blend and not be noticed. And so a lot of times when people ask, what would you do for my nose? Well, it's about blending it so that it fits the neighborhood that it's sitting on, the beautiful piece of property that it's sitting on. So when you talk about procedures to change the appearance of your nose, that's cosmetic surgery, meaning insurance will never pay for that. So this is all going to be out of pocket. Because at the end of the day, the appearance of your nose is not going to change the length of your life, right? But if it really bothers you and it's something that you want to change, then absolutely there's things we can do to help you through that. There's three main ways to accomplish changes to the aesthetic appearance of the nose. One of them is filler, and so that's what some people call a non-surgical rhinoplasty. And what that is basically using filler to camouflage changes in the nose. So for example, if someone has a big bump on their nose and they would like to camouflage that, we can put filler sort of above it and below it to sort of blend that out a little bit. And you can also make tip changes a little bit. You're a little more limited in what you can do with filler as opposed to surgery, but you can take a nose that maybe if it looks droopy, you can put a little filler in the tip to sort of to make it look like the tip is a little higher up. Now you're not removing any tissue, you're not moving tissue around, but it can help with making some subtle changes. And for a lot of people who want really small changes and just want to sort of test drive it, if you will, that's a good way to try that. The other two options are surgical options, and so most people will refer to these as a closed rhinoplasty versus an open rhinoplasty. The main difference between the closed and the open rhinoplasty is how much exposure the surgeon has to the nose and the nasal cartilages. So the reason your nose looks the way that it does is because of the cartilages underneath and the bone up here, okay? The skin is just lying on it like a tent, right? So when we're going to make changes to the nose, what you're changing is the cartilage and the bone underneath. In a closed rhinoplasty, all of the incisions are inside the nose, so you can't see anything on the outside, and it allows the surgeon to access this part of your nose really well. Now, some people will make changes to the tip through a closed rhinoplasty. In my hands, I don't personally do that, but that's what's called a delivery approach, and some people are very good at that and feel strongly about that particular approach. Why do a closed rhinoplasty? Well, you don't dissect as much, so the recovery is a little bit faster. But the downside is that you can't access as much as you can with an open rhinoplasty. So in my hands, I really prefer an open rhinoplasty to make a lot of aesthetic changes to the nose. If you're talking about changing the tip, changing, the character of the nose, the projection of the nose, that's something that you really, in my hands, would do with an open rhinoplasty. What does that mean for the patient? That means that there's an external incision right here that hides really, really well. But it is an additional incision that allows me to access the entirety of the nose, the cartilages down here and the bone up here. With either a closed or an open rhinoplasty, there's going to be a recovery period associated with that. And your nose is going to be pretty swollen afterwards. The surgery itself, depending on what we're going to do in the operating room and what goals we've discussed, can take anywhere from an hour or two to up to 4 or 5 hours if we're talking about a revision rhinoplasty, meaning a redo rhinoplasty, where we have to use rib cartilage, for example, because all of the cartilage in the nose has been used up already. And so the time can vary. The recovery varies as well. If you're talking about a full-on redo with the rib cartilage graft, that's going to take some time, and that's really going to knock you off your feet for about a week, and then really 2 weeks until you're ready to get back to work. The cost is also different. With a non-surgical rhinoplasty, you're basically just paying for the product, for the filler, whereas with a closed or an open rhinoplasty, now you're talking going to the operating room where there's going to be an anesthesiologist fee and a hospital fee, so it is going to be significantly more expensive. When people ask what's the best option for you, it really comes down to what goals do you have as far as what changes do you want to make. And so it's going to be a conversation between you and your surgeon. You need a really thorough exam to look inside and see if there's been any surgery before, how much septum you have to work with. Is the septum straight? Is it crooked? All these things are going to be important, and so it's really hard without examining someone to say, this is what I would do. So it's really worth your time to go in and see your surgeon, to have a full visit and talk so that they can look and see what your goals are as well. So that's some basics on rhinoplasty. If you still have questions, or if there's something else that I brought up that you want to learn more about, feel free to leave a comment. If you don't feel comfortable putting that in a public setting, you can always DM me on Instagram, and I will respond to those questions anonymously. Follow my channel, subscribe, and thanks for listening, guys.